here on the alert desk for Erie News Now. Our John Leidick's going to be so kind as to move the camera for me as we get set for our second Q&A here of the evening. And with me right now is Dr. Nancy Weisbach. She is with AHN St. Vincent. And Doctor, every single time we have these so many questions to answer, but the first question I want to ask is generic with AHN St. Vincent. We saw the first mass vaccination clinic held on Sunday. That was at Erie Insurance Arena. Seemed to run pretty smoothly. Just give me an idea of how that went in your mind.
Oh, it was a fabulous event. I was actually there helping people after the vaccination to watch them and move them out when they were done with their waiting period. The event went very smoothly. We had many volunteers from AHN. We vaccinated about 2,100 people during that event, and we plan on revaccinating all of those folks in about 3 weeks.
How does something like that get put together? We had been hearing for several weeks, maybe there will be a mass vaccination clinic, and it didn't happen until now. Give me the details, the behind the scenes of how that got put together.
Well, first of all, we need enough vaccine.
Right.
So the vaccine was not coming in fast enough in the beginning to have a mass vaccination clinic, but then the state did allot us a significant amount of vaccine, and it took a lot of planning. And I really have to put shout out to the pharmacists, especially the head pharmacist, Steve Henderson, for organizing this project. And it just took a huge amount of coordination, putting this together, and thanking the Erie Insurance Arena for allowing us to have the event there. You have to think about a lot of things, especially vaccine storage. We have Pfizer vaccine. It has to be frozen initially and then thawed. And so all of those logistics have to be thought about, but it went extremely well.
Now, I want to ask before we start going into the questions, because the big question for everyone is what's the future with these mass vaccination clinics? Is AHN St. Vincent planning on having this again, and if so, how closely in the future does that happen?
Well, first of all, we have to have the second vaccination for the first vaccinees. So that will again happen in a little less than 3 weeks. We're hoping that will go off without a hitch. And if we are able to, and we have the staff and the support, here we had support also from the health department with regard to making this happen. But yes, we would like to have many more, if possible, mass vaccinations to vaccinate as many people as we can.
All right, let's get into the questions, shall we?
Sure.
People, questions coming in already. We were joking. We were joking before we brought Dr. Weisbach on, is that she was going to get the majority of the questions because Dr. Chenault got some, but not a lot, and questions are already pouring in here. You've got the primetime hour at 5 o'clock.
I'm ready.
Let's start with K-Dog is the name.
Okay.
Kaylee also asking the question, and this one is a fairly simple one, asking what side effects could you see after getting your first or second vaccine shot?
Okay, so the vaccines that are available right now are Pfizer and Moderna. They do have similar side effects. The most common is a sore arm, and myself having been vaccinated, the arm can be sore for the next 24 to 48 hours after vaccine. Also, the following day, more so than the day you get the vaccine, you might feel a little achy, a little out of sorts, but generally that's very short-lived. Low-grade fever. Side effects tend to happen more likely with the second vaccine versus the first vaccine, and a little more likely with Moderna than Pfizer.
And is there any side effects that should be concerned about for people that might have specific allergies, or I know anaphylactics is one as well? I mean, is there anything that if you have a certain condition that you should be really concerned about?
Well, you definitely should be concerned if you have an allergy to something called PEG, and you can ask your doctor what that compound is, and that's in other vaccines. If you have a severe allergy to PEG, you should be very concerned about getting the vaccine and consult with your physician. In general, though, most allergies that people have, such as egg allergies, etc., are not contraindications to the vaccine.
All right, let's continue along with our questions here. Dr. Nancy Weisbach of AHN St. Vincent. We go to Kim now. Kim says she lives in Franklin. She's wondering if her husband and her can come to AHN and get the vaccine. She is a transplant recipient.
Yes, you can get the vaccine if you are a transplant recipient, as well as your husband, depending on whether he has age or other medical conditions that would qualify him at this time to get vaccinated. You just go to the AHN website and there's information on where to call, or if you have MyChart through St. Vincent or AHN, you can go to MyChart and find out how to sign up for vaccination.
Well, that might be a good time for us to be able to kind of bridge into ways to contact. There was guidance given out by the state a short time ago to make sure hospitals open up the method of contacts. AHN St. Vincent, of course, has used MyChart. There's also phone numbers as well. Have you been able to expand your methods of contact, and if so, just kind of how that process has been as the vaccine process is going?
Well, there is a phone number to call, as well as, again, signing up on MyChart. That's the best way right now to get access to vaccination through AHN.
Now, people are wondering, when it comes to AHN or any hospital, they always get worried that if they're in phase 1A, but they don't call, or they don't feel like if they don't call every day, they're not going to be able to get their vaccine appointment. When an appointment's open for somebody, will AHN call them, or do you have to call or get an email or something like that?
Yeah, if you have MyChart, you will get notified that you are eligible to get vaccinated, and they will notify you and what the next steps are.
Okay. All right, let's go to Rose here. Rose, hello. You are from Warren, Pennsylvania. Hi from Warren. Here's her question. She says, my company sent my vaccine application to their main office in Erie. I work for CRI. I'm still waiting for an answer. She says she's a caregiver. I guess a caregiver is not considered a healthcare worker. I work alongside nurses who visit the same homes, yet I have to wait. What is my situation here?
Yes, as a general caregiver, you are not on Tier 1A. However, just keep looking for expansion to who is eligible for the vaccine. And also, you may have other qualifications for the vaccine other than being a caregiver, which right now is not a qualification. So ask your doctor if you have any medical condition that might qualify you for the vaccine, even though being a caregiver right now does not qualify you.
Doctor, I'd like to ask you about phase 1A in particular. As we've seen time go on, we've seen that expand, right? It's gone from healthcare workers to seniors to anybody with a medical condition between 16 and 64. Correct. Has that presented a challenge at AHN, knowing now that you have a larger group of people that you can only, of course, vaccinate the same amount of people because there are so many doses, but has that created a challenge for you to have to decide, kind of how to distribute those vaccines? Well,
AHN did have to allocate vaccines initially when we had shorter supply to the most vulnerable. Okay. The most vulnerable, those folks over 75. That's where we started. But now we are at the point where we can do all Tier 1A. So we have opened up the schedule to all Tier 1A.
And if you wouldn't mind, just to inform the public again, who is included in Tier 1A?
So in Tier 1A, anyone over 65, even if you're healthy, and then anyone between, for St. Vincent, we're doing 19 to 64, who have certain medical conditions such as diabetes, obesity, and there's a laundry list of conditions that meet Tier 1A even if you're under 65. And your doctor, you can go to the CDC website to look for those, or your doctor can help you determine.
Not sure if this is a question you're able to answer, but have you seen, of those comorbid conditions, of those categories, is there a persevering one? Is there one that kind of stands out above the rest for people who have listed a comorbid condition that have been getting vaccinated?
Certainly diabetes and obesity come to mind right off the bat in terms of folks that we've seen in the hospital who have had significantly severe COVID disease.
Okay, so there are, of course, common ones as compared to,
right,
and there are, of course, outliers as well, as we know of here.
Correct.
And as we continue along. Just want to give a quick update here. The phone line's still open. You see our experts from LECOM with these call-in number, 814-454-5201. You can dial the extension 1. The phone will ring, someone will pick up, and they'll be able to answer your question just as Dr. Weisbach is here. Let's see if we can go back to the questions on Facebook. I'm not seeing anything in particular, so I guess this is a good time, like I was talking to Dr. Chenault. At AHN St. Vincent, you get patients getting the vaccine on a daily basis. What are some of the biggest questions you're hearing people ask as we move forward here?
In terms of the vaccinees,
Yes.
mostly what side effects would I expect, as we talked about previously, and when can I not have to wear a mask and be around people without social distancing, etc. And our answer to that question is you still need to wear a mask and social distance, even though you have the vaccine, including the second shot. There's still a chance you can get asymptomatic or minimally symptomatic COVID, and that could also be infectious to others. And the vaccine really does help prevent you from getting severely ill or needing to go to the hospital, but it's not 100% in protecting you from getting minimal or mild COVID disease.
Let's talk a little bit about what you need to do still after receiving the vaccine. I think, like you mentioned, a lot of people maybe believing that if I am vaccinated, I am therefore immune and I do not need to abide by mask mandates, socially distance. In your mind, how long do you think it is important? I mean, I guess in terms of time frame, how important in your mind is it to be able to remain socially distant, wear a mask, and how long do you think that will continue as we move through the vaccination process?
It's going to continue for a while, and we just have to remember that patience is very important here. It's been a long road. Everybody's tired. We all want to end this, but right now we're at the beginning of the end. I really do believe that. But we have to continue with masking and social distancing until there is enough herd immunity from vaccination, and then of course people who have already had COVID, that our case numbers are extremely low to minimal before, and even then the CDC may continue mask recommendations until this pandemic is over.
Yeah. And I heard you say that you believe this is the beginning of the end, certainly a positive outlook on where we're at right now in COVID. Does that have mostly to do with the vaccine? Does it have to do with the vaccine process, the lowering in cases? Are there components that lead you to have that belief that we are at the beginning of the end of the pandemic?
Yeah, I think the vaccine is a huge game changer here. If we were to wait for herd immunity based on just people getting the disease, of course, the worst part of that scenario is more hospitalizations and more deaths. But also it would take probably years for that to happen. The vaccine is going to speed up herd immunity considerably, which is what we need in terms of ending this pandemic.
Doctor, let me ask you about COVID as a whole here. We've talked about the fact that the vaccine is helping getting people inoculated against the virus, but we're also seeing people maybe who haven't been vaccinated. Cases are lowering in Erie County. We've seen that over the course of a couple of weeks stretch. Just wondering your thoughts on that, and if that's directly related to the vaccine, if the correlation there is leading to a decrease in cases.
I think the decrease was happening before we had significant vaccination in our county. Part of the reason that cases were going down is we had passed the holiday season. People were probably sticking to social distancing and masking a little bit better after the holidays were over. And kudos to the community for doing that, because it has brought the cases down.
Yeah. Are you at all surprised by that we didn't see a spike after the holidays and instead started to trend downward?
Well, we did have still considerable hospitalizations, during that time as an effect of the holiday, probably spread during the holiday. But I was happy that there was not another significant spike after the holidays.
Yeah, of course, that was the concern by lots of medical experts.
Right. There was a minimal spike after the holidays, but not
to the extent that maybe we would have been thinking, because of course we've seen in the last
Right.
July, whether that be last November and whatnot, and the restrictions getting imposed.
So this is the time really to double down on masking and social distancing, because we're making headway and we don't want to turn backwards now.
As we've seen by the mass vaccination clinics that have started, and we'll see if they prod along here. As we go back to the question bank, Lydia has a question. Hey, Lydia, thanks for sending in your question here. What if you have shingles? Is it safe to get the vaccine?
If you've had shingles, it's definitely safe to get the vaccine if you've had shingles.
Okay.
If you have active shingles right now, I would probably wait for those lesions to crust over first before you decide on getting the vaccine. But if you've had shingles or you've had the shingles vaccine, it's totally safe to get the vaccination.
And I think another question that people have too as well is, if I've had the coronavirus within a certain period of time, do I have to wait to get the vaccine until a certain period of time has expired?
So that's a great question. Basically, after you've had coronavirus, you have antibodies. We don't know how long those antibodies are going to last, but we do know it's unlikely for you to get coronavirus again in the 3 months following your illness. So we say that you can certainly wait 2 to 3 months before getting vaccinated, but we do suggest that you get vaccinated. Now, if you've had certain treatments for your coronavirus, especially monoclonal antibody, you do have to wait 90 days after the monoclonal antibody to get vaccinated.
Okay, and what would be the reason? I mean, I'm clearly not an expert in vaccines. I'm just,
Right.
I guess a lot of people curiosity, what's the reason behind that?
So monoclonal antibody is giving you antibodies to the virus, which may blunt the response to the vaccination because you already have antibodies circulating. And those monoclonal antibodies will wear off after a while, generally 90 days. So that's why they want you to wait 90 days so that you won't have a blunting of your immune response when you get the vaccine.
I find that fascinating, interesting, and again, good information for people who are looking to get the vaccine here. Talking with Dr. Nancy Weisbach of AHN St. Vincent, infectious disease expert, knows a lot more than I do, certainly, when it comes to the vaccine. Let's go to Kathleen in the question bank here. She's wondering if this virus is considered a respiratory virus. Why doesn't the CDC have respiratory illness as one of the pre-existing conditions for someone between 18 and 64, particularly asthma?
There are respiratory illnesses that are considered in Tier 1A, like COPD, chronic obstructive pulmonary disease, otherwise known as emphysema. If you have severe asthma, honestly, that's something that most people would say go ahead and get vaccinated.
Okay. So that'd be something that would be probably considered into the category of...
Yes.
Okay. All right, let's see if we can go to more questions here. We're not seeing any at the moment, so I guess we'll go ahead and just continue to talk about the vaccine here as we move forward. One of the things that we really haven't gotten into much is the Johnson & Johnson vaccine. From what you've been hearing, a lot of studies coming out showing that maybe by the end of this week it will be approved for emergency use, maybe by the end of next week. How excited does that make you to know that there could be potentially another vaccine on the horizon that's one shot?
Well, I think that's the thing. Another vaccine on the horizon is more vaccinations we can give to people. And right now, that's our goal, vaccinating as many people as possible. J&J did say that the ramp up will be slow in the first few months after emergency use authorization. They will have less vaccine than they'll have into May and June, but you know, whatever we can get, we want.
And with that Johnson & Johnson vaccine, experts that we've talked to believe that's the pathway for more mass vaccination sites, with it being a single-shot vaccine, potentially more predominant. There could be more shipped out at one time. Is that something you might agree with, or something that you could add to, that a single-shot vaccine in Johnson & Johnson could potentially pave the way for more mass vaccination
I
sites?
totally agree. Logistically, getting a second vaccination is more difficult, and you don't have to rely on somebody coming back, contacting them, etc. One vaccine is always easier than two. So also, it doesn't have to be stored at those super cold temperatures that Pfizer has to be stored at, which makes it easier to get to places that may not have the capability of having sub-zero temperatures available.
Is that a big part to play, too, with the Johnson & Johnson, is that it doesn't have the storage requirements that Pfizer or Moderna would have, and so in theory you could store more vaccine doses at your facilities?
Store more at the facilities, but more so really around the world where there are not the capabilities of having sub-zero freezers everywhere, and transporting sub-zero vaccine to more remote places and underdeveloped places in the world.
Now, Doctor, I'm sure AHN has had conversations about how to incorporate the Johnson & Johnson if and when it does get approved. I'm wondering if you might be able to just shed a little bit of light as to what that distribution plan might look like. Is it going to be incorporated with what's going on now? Is it going to be reserved for potential clinics? I mean, what does that look like?
Right now, We haven't heard of getting any Johnson & Johnson directly, and so we have not, there's no direct plan right now that we have formulated for that. But should we hear that we are going to get J&J vaccine, we will plan accordingly.
Simple enough. Hopefully it does get approved because, of course, I mean, any vaccine that is proven effective. And what's the % efficacy for Johnson & Johnson?
It's excellent. It's over 90%.
Okay. Okay. So
so far, based on what they're saying.
On par level with Moderna and Pfizer.
Yes.
Okay. Let's see what we have with more questions here. Jen has a question here. She asks, when do they plan on having a vaccine for kids under 18, and is the current vaccine safe for kids under 18?
You know, they're studying them right now in children, so I don't know when it's actually going to come out that they will be approved for children under 18.
Is there a different process that needs to be taken to approve a vaccine for adolescents?
Actually, some of the vaccines were studied in adolescents, or teenagers, should I say. But in terms of younger children, they have to do, special pediatric studies and make sure that the parents are involved, obviously.
And that does that normally, I guess with any vaccine, take significantly more time than what would a normal vaccine process look like?
It takes separate amount of time to do pediatrics in general.
Okay, that makes sense. Let's go to Jamie. Jamie's got a question here wondering, can you take the vaccine while also taking steroids for asthma?
You can take the vaccine while taking steroids, but it's really recommended to have the best immune response possible to minimize your steroid dose if you are going to be vaccinated. And your doctor can work with you with regards to that, especially within the first 2 weeks after vaccination, to try to get the best response possible.
Okay. I want to bring up here, as we look in at our call center, you mentioned following up with your primary care physician, your doctor. Is there an importance of keeping in contact with your PCP during this time? I think a lot of people maybe think of vaccine, they think directly to the hospital, right? We're going to go to AHN, we're going to go to UPMC, we're going to go to LECOM. Is there still an importance of contacting your PCP?
Absolutely, especially if you have questions about whether you are eligible to receive the vaccine right now and what the requirements are and what diagnoses you may have that will put you eligible to get vaccinated. I think your doctor should be in the loop for sure if there's any questions regarding that.
Yeah, PCP is still important here as we take a look in at our live call center. Everybody right now is busy. Phones are ringing off the hook again. If you have a vaccine question that you don't ask on here, you can call another one of our experts at 814-454-5201. The extension is 1. You can see via our graphic. You can speak directly with them until 7 o'clock, so you have about half the time left, an hour and a half, before those phone lines close here on our second vaccine extravaganza. As we're back in here with Dr. Nancy Weisbach of AHN St. Vincent, again, thankfully taking an hour of her busy day to spend time with us.
No problem, my pleasure.
Let's go ahead and dive in a little bit. Of course, this is about vaccines, but I think people are also wondering just about the testing and tracing aspect element of this. And I think we all know that the vaccine and that go hand in hand, right? The more people you vaccinate, maybe quote unquote, the easier it is to test and trace. What have you seen with that at AHN St. Vincent since you've been able to start vaccinating, the testing and tracing process?
I think what we've seen is just less positive tests coming back since we've been vaccinating. In terms of tracing, and that's usually done by the health department. So we certainly report to the health department anytime we have positive tests, so the health department can then do their job to contact folks and find who they've been exposed to and who they may have exposed others to the virus.
Alrighty, moving along here in our Q&A session here as we continue with our team of expert panelists and doctors. Dr. Weisbach, I know that the vaccine can be such a tedious subject, specifically when we're talking about not just distribution, but how effective it will be. A lot of questions people had when it came to the efficacy of the vaccine when we first talked in our first Q&A session was that they were worried that because the vaccine came out in such a short period of time, it was a lot quicker than other major vaccines, that it may not be as effective or it was rushed. I'm just wondering to get your thoughts as an infectious disease expert of how the vaccine was able to be created so quickly as compared to others.
Well, it is a novel type of vaccine called mRNA vaccine, but they have been looking into mRNA vaccines for several years. So they knew what to do. And the key was to get enough people in trials where the FDA felt they could do an emergency use authorization. And remember, emergency use authorization is not the final FDA approval. So more data is coming in as millions of people are now getting vaccinated. And we're learning more about the vaccine every day.
And I guess in the mRNA vaccine category, what's different about that process that allows a vaccine to be distributed and created faster?
It doesn't allow you to create it faster.
Okay.
But it is a new technology that if they were starting from anew to create that technology when coronavirus came about the world, it would have taken a long, long time. But vaccine producers were already looking into mRNA technology before COVID-19 hit the scene, so they had a head start.
Well, that's good news.
They had a head start.
And again, this is why I'm asking the questions, because I know nothing about mRNA. Was another part of it, too, because the coronavirus has aspects of maybe other viruses within it that doctors were able to kind of squeeze out and find?
Well, they certainly knew with coronaviruses in general that have spike proteins on them that targeting the spike protein was one good avenue. And they did have some head start there as well based on other coronaviruses, yes.
And again, Operation Warp Speed certainly did happen.
Absolutely.
It seemed like in Warp Speed. And,
yes.
and good news on that front, too, as we move forward. Let's see if we got any more questions. Ruth has a question here. Ruth is concerned if miscarriage is more likely after taking the vaccine for women who might be pregnant.
They have not shown any significant adverse outcomes in pregnancy of those people who have been pregnant and gotten the vaccine, and increased risk of miscarriage to date has not been noted.
So it's not a factor at all here when it comes to the vaccine.
I will say that the recommendation for pregnant women is if you're low risk for getting COVID and you're low risk for getting severe COVID illness, you're a healthy young woman, you can speak with your doctor, but weigh the risks and benefits of any treatment of any kind of having the vaccine now versus delaying until after you deliver the baby. But if you're in a high-risk situation, you're a healthcare worker, or you have other underlying diseases that really put you at high risk for getting severe COVID disease, you strongly should consider the vaccination in consultation with your physician.
Why don't we talk a little bit of that more as we continue our vaccine coverage here. I lost my train of thought. We were talking specifically... Oh, no, you're totally fine. We were just talking about miscarriages in pregnancy and the concern with what side effects there could be. I guess as a bridge question here, are there any extreme cases of side effects that you've seen in patients after they've received a vaccine at AHN St. Vincent specifically?
We really haven't seen any severe life-threatening reactions. We've had a couple of people who have had significant reactions where they have ended up briefly in the emergency room, getting a few treatments, and then going home. But we have not had any severe life-threatening reactions.
And like you said, side effects are what you would expect in just general soreness.
That's right. I mean, severe life-threatening side effects from the vaccine are extremely rare. They're extremely rare. The risk of dying from COVID, should you get COVID, is certainly higher than the risk of a severe life-threatening reaction from the vaccine.
Let's go in a little bit more in depth to kind of a situation that we had heard in our first Q&A session that was talking about individuals who had received the COVID-19 vaccine in a different location, their first dose, And then they had moved back to Erie or somewhere else,
Right.
and they were looking for their second dose, but they really were concerned that they had to go back to the same area. I mean, is it important to get the vaccine at the same hospital or same place, or how would you go about that?
You know, right now, it's so much easier if you get it at the same place you got your first. Logistically, it can be a challenge if you got your first vaccine, let's say in Florida, now you're coming home to Erie. You really should try as hard as you can to get the vaccine in the same location, because it will be easier to find your second shot. And I worry that some people will end up not being able to get their second shot in a timely fashion if they go to a different location.
And is there anything specifically, I mean, is it, for somebody who maybe can't go back to that location, what do you do in that situation? I mean, is there anything that you can do to try to still be able to get that second dose of the vaccine?
I think you can try to sign up through the usual routes that people are signing up. And you could, call the phone numbers that are available and see what the folks say on the other end with regard to getting your second shot here in Erie or somewhere else if you got your first shot here.
Right. And we have to ask this because this, of course, is a question that people have brought up in the past, is Pfizer and Pfizer, Moderna and Moderna, they should not be
Absolutely.
mixed.
Right now, the CDC says do not interchange them. And if you got Pfizer number 1, you should get Pfizer number 2, and Moderna the same.
So we have Pfizer, Moderna, potentially Johnson & Johnson. I'm curious because I think once we distribute more vaccines, once we create more vaccines, maybe there'll be another company. Are there any other companies, to your knowledge, that are in potential conjunction of distributing a vaccine?
Well, we know AstraZeneca's available already. It's being used heavily in Europe. Mm-hmm. But those are the main ones right now that we have in the pipeline.
All right, let's go back to talking about what you need to do once you receive the vaccine. You had mentioned, of course, that wearing a mask, socially distancing, is still critical, even when you do receive the vaccine. I think what a lot of people are wondering, seniors vaccinated who are over 65, a lot of them grandparents, a lot of them have grandchildren in which they've been vaccinated, but grandchildren, of course, have not been because they're under the age of 18. Would it be safe to still see your grandchildren, your parents, your kids, things of that nature, if there are some people who have been vaccinated, but others have not?
Well, children, interestingly, as people know, generally do very, very well with COVID-19 and tend to have asymptomatic or very minimally symptomatic illnesses. However, it's always that rare case where a child can get ill, significantly ill. So, and again, as we talked about, even after you've been vaccinated, although the chance of spreading COVID is probably way down based on some recent studies, still always that small chance you could get a mild case of COVID after vaccination and spread it on. So I think at this point, everyone has to, make their own decisions. But at this point, especially if you're dealing with folks around you that are not vaccinated, who are not young children, but even young children, to still socially distance and wear a mask. This is tough. It's really hard. We're going on the second year. But as I said, we need to be patient until this epidemic has subsided to the point where the CDC feels we can relax our social distancing and masking, which is not going to be in the near future right now.
Anyone's guess when that will be. If you can hit that date on the nose, you're very, very good at predicting the future.
What we're hoping for really is at some point anyone who wants a vaccine can get a vaccine, including children, and that we will be around only vaccinated people, and then it will be safer to be a little closer to those folks.
Makes a lot of sense here. I want to show you as well the call center. Of course, calls continuing to stream in with our experts from LECOM, experts from other hospitals here on the alert desk with us. You can call until 7 p.m. That phone number again, we'll repeat it for you one more time, 814-454-5201. Dial the extension 1, you'll be connected. You ask your question, get your answer. If you need to ask another question, call again. The phone lines are open until 7 p.m. this evening. Talking again with Dr. Nancy Weisbach of AHN St. Vincent. Let's go to William here on our question portal. William is wondering, and this is for AHN, why was AHN able to have an open shot clinic when other people 70 and older are still having trouble getting the vaccine? I guess the question becomes, how is AHN able to have that mass vaccination clinic when there's still, of course, a lot of people in phase 1A get to be vaccinated?
Right. We're just trying to get shots into people's arms as best we can. And the clinic that we had at the Erie Insurance Arena got 2,100 people vaccinated, and we hope to have more of the same if and when we have enough supply to do it. So we're working as hard as we can. Unfortunately, everyone can't get vaccinated all at once simultaneously right now, but we're trying to allow the most vulnerable people to get in and get vaccinated. And now, again, it's at the hospital. We are doing all Tier 1A, but again, we do have the capacity that we have, and we're working as hard as we can.
Doctor, do you envision the Erie Insurance Arena being the main venue for mass vaccination clinics in the near future if there were to be some?
That's one potential venue. I know that there's vaccinations going on at the Bayfront Convention Center. There's many different areas, and once the weather gets nicer, maybe there will be some outdoor venues that we can use as well, some large parking lots, etc. So it's right now it's pretty dependent on supply of vaccine. We're still the demand is higher than the supply.
Right, and that's the big 3-word demand. More than supply, the big 4-word chain of words that you have to put there. Doctor, let's continue to talk about vaccine locations. I want to shift to this. The county executive on Sunday during the mass vaccination clinic stressed the importance of course, wanting to make sure the urban areas continue to get the vaccine within the city, within the region, but also talked about wanting to push vaccination efforts out to rural areas, whether that be Albion, Edinburgh, and I listed them too when we talked to Dr. Chenal, talking about Albion, Edinburgh, Union City, Corey, those rural areas. Gerard's part of it too. How does that work? How realistically do we get that to happen where rural areas can be served in the same way, in the same accessibility as the urban areas do?
Yeah, that's a little bit more of a challenge because you have to spread out your staff over a large area of over a larger area, and generally it's logistically easier to vaccinate more people in a centralized area than spreading out into smaller areas. But once we have more vaccine, that is certainly something that we can look into, getting into the rural areas. Many people in the rural areas do have the ability to drive in, so we're still hoping that we can vaccinate those folks by having them come into a more centralized area. But getting out into the rural areas is another venue that we can look into when we have better supply of vaccine.
What would the supply need to be? Whether it's a number, whether it's a percentage, how much of an increase in supply would you have to see to consider start moving things out to rural areas?
I think when we get to the point where we have vaccinations that just need to be regularly frozen and not sub-zero, such as Moderna, and we have enough vaccine as we do with the flu shot, we can get it out to all the pharmacies. The pharmacies are probably one of the best ways we can get vaccine to rural areas, because there tend to be pharmacies even in small towns, often have at least one pharmacy in small towns. So when there's enough supply that any pharmacy in any small town can get a vaccine as they do the flu shot or the shingle shot, then we will be in good shape for local vaccination of rural areas.
So in other words, the supply has to outweigh the demand. You have to feel very confident that the supply has to outweigh the demand.
At least meet the demand, yes.
Doctor, let me ask you a question about pharmacies, because that might be the next phase of distribution sites here as we move forward. How important do you believe the pharmacies will play a role in when it comes to making sure that the vaccine's distributed in a good way, especially in those rural areas?
Well, I'm thinking, and this is just on my own thoughts, that pharmacies are a great way to vaccinate the public, and we've seen that with many other vaccinations, as I mentioned. And pharmacies also took a huge role in our community vaccinating for COVID-19 the nursing home patients. They went out to the nursing homes and vaccinated many of the patients in long-term care. So I think they're a great resource for vaccinating the public all over, rural and urban, and I hope that the state uses them efficiently.
And of course, when it comes to pharmacies, that's another location that you can use, but it's also a location in which you have to have the staff, like you said, to be able to run it.
You do.
What goes into training, getting those staff informed so that when the vaccine does eventually come to those areas, they'll be prepared?
Well, they have to know the potential side effects of the vaccine, but most pharmacies right now are already vaccinating against other illnesses, and these staff are well versed in how to administer vaccinations similar to this one, and I don't think it would take a huge amount of training to learn how to vaccinate the COVID-19 vaccine versus any other vaccine.
So the timing wouldn't be significant?
I don't think so. I would not think so, no.
What kind of training, besides administering the vaccine, has to go into that training period? Is it just teaching them how to administer, or is it teaching them, you know, the potential of the process or the risks or things like that? I mean, I'm sure there's a lot of steps that have to be done to be able to make sure people know how to effectively distribute the vaccine.
Sure. I mean, someone who's not not a medical person in general, pharmacists did not give vaccinations 30, 40 years ago. This has been relatively new in the last generation of vaccinating people, and pharmacists, they need to learn how to administer vaccine, the physical aspects of administering a vaccine, and they have to know how to store it and draw it up properly, and they also need to know the side effects of each vaccine in case something happens to the person that they're vaccinating.
Jumping from distribution to distribution on a different note, as we wait for more questions to come in, Doctor, there was research just recently that showed it's possible to get more doses out of a single vial. Has AHN St. Vincent been able to do that, and if so?
Oh, yes. Initially, they had said, I think, 5 doses per vial.
5, yeah.
We certainly can get 6 out and rarely 7. So we have had extra doses from, and we tried to use them all. Absolutely. Yes, we do have more doses than was originally said by Pfizer.
Now, are the vaccines that you receive each week, is it a consistent supply? Does it vary? And if it varies, is it normally lower or higher than weeks past?
It varies. But in general, right now, we are certainly getting more in at a time than we were getting in, let's say, a month or 2 ago.
How far out is AHN St. Vincent scheduled? I know when we had LECOM's director of pharmacy on, he had mentioned that LECOM was booked with vaccines up through March. Is that a similar trajectory for AHN?
I know we have vaccines booked into March. I'm not sure the actual end date of the last person that's booked at this point in time.
How do you keep track of all of those appointments? I mean, obviously, my chart, the website's a big part of it, but...
There's a computer system that is being used by the pharmacy department for that.
Okay. And, of course, when it comes to tracking, you also have to make sure that people have enough doses to give people their first dose and second dose. And so it brings me to my next question here, which is what people are calling vaccine hoarding. We've had a series of calls into our newsroom in the last couple of weeks. People frustrated because they feel as if individuals eligible for the vaccine are signing up, not just at AHN St. Vincent, they're signing up at UPMC Hammett, they're signing up at LECOM, they're signing up at wherever the vaccine is eligible, and that's creating a bit of a backlog. Have you seen / have been concerned about that as we progress through this phase 1A?
Well, what happens with that is eventually the person only gets one, their first dose and their second dose, even if they signed up in multiple places. Mm-hmm. What happens is someone may be a no-show at your vaccine clinic if they signed up in 2 places and got it somewhere else first. But it doesn't matter. We still end up using all the vaccines up that we have. So,
in your mind, because I'm just curious about this, what is the backlog, if you had to guess, of number of people who are waiting compared to the number of doses that you have?
I mean, right now that we have a large group of people that fit into Tier 1A, there's a huge number. The demand is certainly outweighing the supply right now, significantly.
If you had to put a pin on, besides the demand versus supply issue, of one big inhibitor, if you will, that's slowing down or keeping the process of this distribution from speeding up, what would that be in your mind?
Well, right now in Erie, it's just getting enough vaccine to the area. If they were to unload, let's say, 100,000 vaccines all at once, then we would have a little bit of a resource issue on how to administer all of that vaccine. But right now, it's more of the supply of the vaccine rather than a resource of administering.
Again, we long for the day where the supply outweighs the demand, but that day's still a long way off. Let's show you back inside our call center here. We'll show you the number again, 814-454-5201. If you have a question, no matter how off the book you think it is, please ask, call until 7 p.m. That number, the extension of 1, gets you to our vaccine call center. Experts from LECOM and all across the region standing by to answer your questions, as is Dr. Weisbach here on our alert desk this evening. Doctor, let's conclude here in the next couple of minutes with just some final thoughts. I mean, I know that every single week we get new questions, we answer those questions, and then we get new concerns as well. For people that are looking to get the vaccine, for people that still are in doubt as to whether or not they believe the vaccine will ever come to them, what's your message for people across the Erie region who are still waiting really in limbo to see how this vaccine process will turn out?
I just want people to be patient. It's going to happen. There's going to be a point where everyone who wants a vaccine can get a vaccine, as long as you're eligible. It's frustrating. I realize that. I know my parents waited a long time at the age of 89 years old in Florida to get their vaccine, and they just got it a week ago. So just be patient. It will happen, and you just got to be patient and don't give up. Don't give up, and keep going to the venues that you have to try to sign up if you meet the criteria for Tier 1A right now. Yeah,
those wise words as the waiting game continues. Doctor, do you have, I know it's hard to put a nail on it, a pin in it as to when we could see maybe a Phase 1B happen, but do you have a projection, even an educated guess as to when Phase 1B could potentially begin?
I really don't. I'm hoping by May or June that we'll get into the 1B by that point, and certainly hoping by summer, early fall, that we're at the point where almost anyone can get vaccinated at that point.
And Doctor, do you feel like once Phase 1A starts to roll through, that Phase 1B and Phase 1C and then subsequently Phase 2 will be a faster expediting process?
I do. I think the vaccine production is going to ramp up more exponentially as we get into the spring, especially with the Johnson & Johnson.
Final thoughts here, Doctor, as we wrap up here. I know you talked about the need to stay patient, the need to be able to understand and wait. And with that, of course, I believe you would also say the need to continue those other measures to keep people safe, like you've been talking about. Absolutely.
Absolutely. And, 20 years from now, when you're talking to your grandchildren about this, you'll be glad that you did everything you needed to do to stay healthy and keep your family healthy. And just, this will end. This will end.
It makes you wonder what will happen in 20 years.
We don't know when, but this will end.
That's the hope, of course.
That's the hope.
And that's where we're headed to right now. Dr. Nancy Weisbach from AHN St. Vincent. Doctor, I want to thank you for your expertise.
You're very welcome.
These are long hours, I'm sure, for long days and long weeks. And this might seem like a bit of a reprieve for the people asking the questions. They sincerely appreciate your expertise. And And the hope, obviously, more mass vaccination clinics will continue, as we saw last Sunday with the Erie Insurance Arena. And you said as the final word here that might be happening again soon.
We hope so. We just got to get some more shots over in the freezers.
That's the big thing. Again, we've said it throughout the entire thread of this interview. The demand right now still outweighing the supply, and until that changes, things are still going to be up in the air. Doctor, again, thank you so much.
I'm sure we'll
talk to you again soon, because we know this vaccine question and answer session won't go away.
Thank you.
All right, that's Dr. Nancy Weisbach from AHN St. Vincent. We are going to take a look one more time at our call center. Here you have an hour, 6 minutes, and 18 seconds officially to call in until 7 p.m. until the phone lines shut off for the evening. Any vaccine question you have, no matter how big, no matter how small, no matter how off the wall or in the box it is, make sure to call this number, 814-454-5201, dial the extension 1, and we will have that information for you with our panel of experts. So we spoke to Dr. Nancy Weisbach from AHN St. Vincent. Earlier today, we spoke with Dr. Jason Chanel of UPMC Hammett. And when we come back here on our Alert Desk coverage, we'll speak with Dr. Becky Dawson, an epidemiologist and professor at Allegheny College. We're going to take a short break for you. We've got a lot more coming up, though. Still another hour left to go in our question and answer session on Vaccine Question and Answer Day number 2. That's coming up shortly, everybody. Until that time, stay safe.